Call to order the November 11, 2014 meeting of the Oshkosh Common Council. I want to welcome those of you that are here in the council chamber tonight. I also want to welcome those of you who might be watching us on Channel 10. Also those who might be watching us on the computer, and those who might be listening to us on the computer or listening to us on the radio. This is your city government, and we hope you participate in any way that works for you. So again, I welcome you. I'm going to ask clerk to take the roll call of the council members.
Peck.
Here.
Herman.
Here.
Allison Osby. Here. Pansky. Here. Fitzgerald.
Here.
Cummings.
Here.
Tower.
Here.
Present 7.
Okay, I'd like everybody to stand. And the first thing we want to do tonight is we're going to have a few moments of silence. Today is Veterans Day. We want to recognize our veterans, particularly those veterans who gave their lives for our freedoms here in this country, those who may have been injured in some way and died an earlier death than they might have otherwise, those who are disabled. And so if we can have some silence, maybe 30 seconds of silence, and then Councilmember Peck will handle the invocation, then we'll do the Pledge of Allegiance led by our students.
We are mindful of the blessings of liberty that we have in this nation. May our decisions tonight improve the quality of life in our city and for our residents. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
You're good. If our students just turn around so people can see you out there and who are watching at home on their televisions, and you can just move over a little bit to the center of the room here. And we do appreciate you coming down, particularly on a night. It's not very nice out there, but could be worse. Some of our friends up north are getting a little more snow than we are. Maybe you could tell us a little bit about yourselves. Watch out there so people can see you. Why don't you tell me what your name is, where you go to school, what grade you're in, and given this is the Thanksgiving season, maybe something that you happen to be thankful for yourself. So I'll pass the microphone down here.
My name is Will Kehoe. I go to Valley Christian School, and I'm in 5th grade. And I'm thankful for my pets, my 2 cats and my dog.
I'm Tiffany Jeffers. I go to Oshkosh Christian School, and I'm thankful. I'm in 5th grade, and I'm thankful for my horse, Leela.
Again, we thank you. I have a little certificate here for you. You can take home and kind of remembrance of tonight. Will, there you are. Tiffany, there you are. If we could have a hand for our students. Now you two can take off, as can your father and your grandmother. Yeah, I do have a proclamation I want to read, and this has to do with Small Business Saturday, which is coming up, which I think is extremely important. Small businesses are the backbone of our economy, so I think it's important that we do recognize them. Okay, whereas the government of Oshkosh, Wisconsin celebrates our local small businesses and the contribution they make to our local economy and community, according to the United States Small Business Administration, there are currently 23 million small businesses in the United States. They represent more than 99% of American employer firms, create 2/3 of the net new jobs, and generate 46% of our gross domestic product. And whereas small businesses employ over 55% of the working population in the United States, and whereas 89% of consumers in the United States agree that small businesses contribute positively to the local community by supplying jobs, generating tax revenue. And whereas 87% of consumers in the United States agree that small businesses are critical to the overall economic health of the United States. And whereas 93% of consumers in the United States agree that it is important for people to support the small businesses that they value in their community. And whereas Oshkosh, Wisconsin supports our local businesses to create jobs, boost our local economy, and preserve our neighborhoods. And whereas advocacy groups, as well as public and private organizations across the country, have endorsed the Saturday after Thanksgiving as Small Business Saturday. Now therefore, I, Burke Tower, Mayor of the City of Oshkosh, do hereby proclaim November 29, 2014 as Small Business Saturday, and urge the residents of our community and the communities across the country to support small businesses and merchants on Small Business Saturday and throughout the year. So we have a period coming out which a lot of people will be going out and shopping, so urge you to shop locally and shop our small businesses in Oshkosh. Okay, that takes us to a public hearing. And I'm going to read the public hearing announcement 3 times. And if you'd like to speak to this, it has to do with the city budget. You may speak to it, come up to the microphone, and make any comments you would like about the city budget. And we will do this again at the next meeting. And at the next meeting on the 25th, I think it is 25th, we'll actually be voting on the city budget that night. There'll be an opportunity for individuals to speak about the budget on that night also. So here's the public hearing first. Number 1, 2015 city budget. 2015 city budget. 2015 city budget. Okay, as I said, there will be opportunities at the next meeting to speak also. Okay, it brings us to citizen statements to council. This is an opportunity when you can come up and make a comment about the city, maybe something positive that's going on or something of concern to you here in the city. If you'd like to come up, you can come up to the microphone. We ask you to limit your comments to no more than 5 minutes. Give us your name and address as you get to the microphone. Do not speak about anything else on the agenda tonight at this particular point in time. There'll be no electioneering, and direct your comments right at the council. I see no one coming forward. Takes us to consent agenda items. The consent agenda is made up of non-controversial items, or at least items that the administration feels are non-controversial, and we consider them as a package unless either a citizen or a council member pulls a particular item from the consent agenda. What I'm going to do is read through the items. If you'd like to speak to one of these items, please come up to the microphone. It's open. Give us your name and address and make your comments about the particular item. I'll start reading through them. Approval of bills presented by the Finance Director. Resolution 14-491, approve agreement with Green Lake County Hazardous Materials Response. Resolution 14-492, award bid for Public Works contract number 14-17 to Vinton Construction Company for Marion Road Storm Sewer Outfall. Resolution 14-493, approval of 2014 landfill tipping fees with Waste Management of Wisconsin for disposal of contaminated soil from Marion Road Storm Sewer Outfall. Resolution 14-494, approved labor contract Oshkosh Professional Police Officers Association, OPPA, for years 2015, 2016, 2017. Resolution 14-495, disallowance of claim by Melissa Heff. Resolution 14-496, disallowance of claim by Patricia Hawkins. Resolution 14-497, approve appointments for Transit Advisory Board and Bicycle and Pedestrian Advisory Committee. Resolution 14-498, approve Class B fermented malt liquor licenses, Class C wine license, agent changes for Class A fermented malt license, special Class B licenses, operator licenses and secondhand dealer license. One more chance to come up. See no one coming forward, I'll bring it back to the council for any comments or questions on any items on the consent agenda.
Mayor.
Yeah, sure.
Mr. Fitzpatrick could come forward, please. It's reference the Professional Police Association's contract 14-494. Thank you, John. Since you were part of the negotiations, you want to just kind of give us some highlights and some things that citizens would be interested in knowing about this contract?
Sure, I'd be happy to. The negotiations, I thought, went very well. The membership of OPPA understood that the city was in difficult financial circumstances in regard to the budget, and they wanted to be as cooperative as they could be. I think we had, I would say, maybe 3 to 4 meetings, actually. It was one of the most concise bargaining cycles that I've had with the union in the time that I've been here. So they had a very positive attitude and made it known immediately that they wanted to try to get something done. So the agreement is pretty Spartan. There aren't a lot of items, with the exception of wages. The duration is 3 years. There are 3 other elements that are part of the agreement. If you'd like me to go through them, I could.
Yeah, go ahead.
Okay. For the wages, there's for the across-the-board portion of the wage increase, for 2015, that amount is 2.5%. For 2016, it's 2.75%. And for 2017, it's 2.75%. The second item that was agreed upon was the idea that they wanted to have their compensation time paid out a little more frequently. So that's that element, rather than, I believe, on a quarterly basis. It's paid out on a monthly basis now. In kind of linked to that item, one of the things that the city wanted to have accomplished was to change the pay date from Thursdays to Fridays to give us a little more time to process any changes that might come up with the payroll. The union also agreed to modify the caps in their collective bargaining agreement as it relates to insurance. Because we're a self-funded insurance program, we have the ability to establish the insurance premiums every year. So in our collective bargaining agreement, there are some caps that are placed in there as kind of a safeguard from the union's perspective that are what people might more commonly understand as not to exceed. So they agreed to increase those caps by 12% this next year, and then 8% the following year, and then 8% the following year after that. So that was the insurance component. And then the duration of the agreement is 3 years. And then the only other final element was some language associated with our sick leave. Protective services employees have the ability to, if they have accumulated sick leave, to place some sick leave in their deferred compensation account 3 years prior to them leaving. And there, as the language read, they had the ability to receive this benefit upon separation and disability, and they wanted to add the words "or death." That wasn't an option that was available to them in the past. Okay. And that's a common option for this type of benefit. So that language was added, and also the other small language change associated with this was before they could place it in, they had to accumulate up to 150 hours, or I'm sorry, days, and that was struck, and it was up to 150 days. So they can place that amount into that fund, although they might not have 150 days accumulated. And that's the balance of the tentative agreement.
Okay, thank you. Normally, we have done 2-year contracts with the police union. This time it's 3. Do you think that's beneficial to us to go out 3 years with where things are at, economy-wise, et cetera?
Well, I think certainly, from a budgetary perspective, it's comforting for the council to know what the parameters are, or what the circumstances are. I know that's something that the council has been wrestling with for the last several years, not knowing what wage increases are. And because police are still have the ability to go to arbitration, and we're subject somewhat to the comps, our other communities, our comparable communities, it made it difficult for the council to try to forecast into the future in terms of what we might have to pay for labor agreements. So from that perspective, I think it's beneficial. I believe that, I can't completely speak for the Oshkosh Police Professional Association, but I think they really don't like to go through the bargaining process, other than certainly they have the ability to make their wishes known and talk to us about any subject. Hopefully they feel like they can do that at any time. But it can be a difficult exercise to go through. So I believe they appreciate the fact that it's a little longer term, the cycle.
Okay, very good. Thank you. That's all I have.
Other question? Comments? Just make a comment. I think it's important to recognize that, as you indicated, the average salary increase is 2.5% next year, 2.75, and 2.75. But as a result of things that have been in contracts over time and other parts of the compensation system, actually wages will be increased considerably more than that. Be 3.5% next year, 4% the year after, and 3.5% the year after that. So it affects budget. And then in terms of total compensation, it's 3.7% next year, 4.9% the year after, and 4.4%. So we'll have pretty good pressure.
Yes.
Continue to have extreme pressure on the budget there
That is true.
higher than the 2.5, 2.75, and 2.75.
Absolutely.
I think we have to keep that in mind. Any other comments, concerns, questions? Okay, anything else, anywhere else on the consent agenda? Anybody want to have an item removed from the consent agenda? Okay, I will look for a motion for the consent agenda.
So moved.
Second.
Been moved and seconded. Any further discussion on any item? Okay, I'll ask clerk to take the roll call vote on the consent agenda.
Pack.
Aye.
Herman.
Aye.
Ellison Osby.
Aye.
Pansky.
Aye.
Fitzgerald.
Aye.
Cummings.
Aye.
Tower.
Aye.
Carried 7.
Okay, the next items removed from the consent agenda. None were removed. The next thing is a pending ordinance. This is an ordinance which I'll read. If you'd like to comment on it, please feel free to come up to the microphone. Ordinance 14-499, amend ordinances pertaining to municipal parking lots. If I'd like to come forward. See no one moving towards the microphone, I'll bring it back to council for a motion and a second on ordinance 14-499.
So moved.
Second.
Been moved and seconded. Any discussion? Questions? See none, I'll ask clerk to take the roll call vote on ordinance 14-499.
Pack.
Aye.
Herman.
Aye.
Ellison Osby.
Aye.
Pansky.
Aye.
Fitzgerald.
Aye.
Cummings.
Aye.
Tower.
Aye.
Carried 7.
Okay, it takes us to a new ordinance, and this new ordinance requires readings of 2 council members, so will actually be considered for approval at the meeting on the 25th, but the first reading is tonight. It's ordinance 14-500 to cancel the December 23, 2015 meeting of the Oshkosh Common Council. Anybody like to come forward and comment on that? Okay, unless any councilors want to comment on that, I will move on. Pending resolution, Resolution 14-501, approve 2015 Business Improvement District Operating Plan and Budget. City manager's recommending holding it over until the November 25th council meeting. If anybody would like to comment on that operating plan and budget, feel free to come forward. Okay, I'll bring it back to the council. Maybe the city manager would like to explain why he'd like it tabled again until the 25th. This was tabled actually from the last meeting, so we thought we were voting on it tonight.
Following the council meeting, I had an opportunity to meet with Dave Spar, who's the president of the bid board, as well as Megan Lang, who's also on the bid board. And we had some discussions initially about the concern that I had that I brought to council's attention regarding the parking utility fund. And they felt it was appropriate that I meet with the entire bid board. The bid board does not meet until a week from tomorrow. I believe it's a week from today, the 18th. and they asked that Jeff Now and Jim Collins and I attend that meeting to discuss with them some of the issues regarding parking, which I've explained to council. I think council's pretty aware of those. I also pointed out to them that there were issues that were raised by council members at the meeting, and that it may be appropriate for bid members to talk to individual council members about their concerns, because there are a variety of concerns that were expressed by council members. But from my standpoint with the parking issue, because I brought that issue up, I felt it was only fair to the bid board that I attend that meeting and talk to them directly about that, rather than just the bid budget committee.
Okay, nobody's come up. The motion's been moved and seconded. It's already on the floor from the last time. It was tabled until today, so any discussion or any desire to move to table it until the 25th?
I would move to table it until the 25th based on Mr. Roloff's request.
Second. Been moved and seconded. Basically an amendment here. If anybody would like to comment on that, putting it off for 2 more weeks, please come forward. Ain't no one moving to come forward. I'll bring it back to council for any discussion on that. I see none, so I'll ask clerk to take the roll call vote on tabling Resolution 14-501, or put it until the November 25th meeting.
Peck,
Aye.
Herman,
Aye.
Ellison Osby,
Aye.
Pansky,
No.
Fitzgerald,
Yeah, aye.
Cummings,
Aye.
Tower.
Present.
Carried 5-1, 1 present.
Okay, that takes us to Resolution 14-502. There's a new resolution. I have 2 new resolutions. We'll go through them one at a time. If you would like to comment on it as I read the resolution, feel free to come forward to comment on it. First of all, Resolution 14-502, approve intergovernmental cooperation agreement with Winnebago County and Oshkosh Area School District for operation of an employee health clinic. Anybody like to come forward? We had some discussion on this in a presentation, the last council member, if people were watching. Okay, I'll bring it back to council for a motion and a second.
So moved.
Second.
Moved and seconded. Discussion by council members. Yes, this was discussed last time, we're looking at going together with the county and with the school district and setting up a health clinic that we think will benefit our employees and will also benefit the budget over time. Okay, I'll ask clerk to take the roll call vote on Resolution 14-502.
Peck,
Aye.
Herman,
Aye.
Ellison Osby,
Aye.
Pansky,
Aye.
Fitzgerald,
Aye.
Cummings,
Aye.
Tower.
Aye.
Carried 7.
Resolution 14-503, approve agreement with Intera Health, Inc. for the provision of employee health clinic services. Come forward.
Good evening. My name is Gary Gray, 815 West Linwood. In regards to Resolution 14-503, I'm a little bit unclear on the cost of this agreement. I understand there's startup cost, but I'm interested in what is the known annual fee for this agreement.
And maybe you ought to come up, because actually this has changed a little bit over time, so maybe we all need some clarification on that at this point. So I might as well do it right now, then we can come back to it.
Sure, I'd be happy to address that question that Mr. Gray brought forward, and I think I can simplify it really in 3 steps. The clinic, there are some startup costs for the clinic. Those are about $13,500. And those startup costs really involve the work that our vendor, Intera, has done initially. They're in the process of securing staff people and interviewing them, researching some sites that we had as a potential clinic location, doing everything from designing the new floor plan to entering into the lease agreement and demolition. So there are a variety of things associated with that startup, that one-time startup fee.
Just a clarification. In our information, we have the engagement fee is $13,000. You just stated it was $13,500, which is correct.
I believe it's $13,500. I could be,
Okay.
I'm just doing this from memory.
Okay.
So, And then the second component is an arrangement that we have with our partners. And the mayor mentioned that we have an intergovernmental agreement with the Oshkosh Area School District and Winnebago County. And the way that we initially structured this was to create a commitment from all three partners for a 3-year duration. And that commitment for the fixed costs, and I'll explain that a little bit more completely, is based on the potential usage of our covered lives. So because the school district is the largest partner, they're responsible for 50% of those costs. The county is the next largest, they'd be responsible for 30%. And because we're the smallest partner, based on the percentage of our covered lives, we have 20%. So what will happen is we'll pay 20% of those fixed costs, and we'll also pay 20% of the utilization when our employees go to that clinic. And then after the initial 6-month period, we'll get together with the other partners and reconcile the utilization. In other words, if our employees use the clinic more, then we'll pay more as part of that arrangement for utilization. But the fixed cost percentage will remain. And that was something that was very important to the partners to make sure that they made that 3-year commitment. I know City Manager Roloff helped add that component to the agreement, and I think it's a good one.
Yeah, after we were discussing this, you always try to take a look at different scenarios that could happen, and I felt it was important that everybody stayed at the table and continue to contribute and be part of it so that they had ownership, even when the number of people participating could go up and down. And given the fact that we were the smallest partner, from my standpoint, I felt it was important to keep the other two partners that represented 80% of the whole thing, wanted to keep them more engaged in it, and I felt that having a portion of those fixed costs allocated to us on a proportional basis kept everybody in the game on an ongoing basis. And I've had other arrangements, other intergovernmental arrangements where a component of fixed cost, having it in there, even though we had talked about earlier it being entirely variable, I thought after a while it may benefit us to have that with us being the smallest partner.
So that...
Okay, what I'd like to do now is maybe, he asked the question about the cost, we got the cost on the table. We'll see if he wants to respond to that, and then we'll get the motion on the floor.
Sure.
If you stay here, then we may ask you some further
Sure.
questions.
The only final thing I would add is, with the exception of those 3 elements, those cost elements, there are some things that are individually charged, that will be charged directly to each entity. Things that are not necessarily utilization or fixed costs. Like, for example, if we decide we want to have our health risk assessments done by Intera, that would be they would just directly charge us for that kind of a la carte option. And that's really the balance of the fixed structure in a simplified form.
Yeah, if you hang around up here in case the council members have it, and I'll let Mr. Gray make his comments now. He's still got about 4.5 minutes to go.
I'm sorry. I'm sorry, Mr. Mayor, my question was not answered. Let me see if I can give an answer to my question. It seems to me like the fixed cost is for nurse practitioner for $16 for 46 weeks at $15 an hour. Also, there's a monthly rent, and according to my arithmetic, it will cost. Okay, I'm sorry. Let me back up a little bit. I do not think the council should veto this. I think they should accept this. All I'm just trying to do is get an actual alternative money figure on the table. Okay, the nurse practitioner. And then there's the office rent, I think of $8,400 a month, and that adds up to roughly, and there's also some administrative help, so that adds up to about, I would guess, about $220,000 a year. That's all I was going to say. Thank you.
Okay, anybody else like to comment on it? Okay, I'll bring it back to the council for a motion, second on resolution 14-503.
So moved. Second.
Been moved and second. Open it to discussion by council. If you want to.
John, Mr. Fitzpatrick, can you respond to is that kind of what we're looking at is for the costs of the service, but then the reason we're doing this is similar to what many, as we see in the supporting documentation, that J.J. Keller and Associates, Breakbush, City of Sheboygan, Northern Engraving, Trek, Dean Health, other companies, private companies are putting these clinics in and are actually finding that it's a savings overall, even when you build in the costs of the service, and this will assist us in getting our health costs down a little bit.
That's the hope, and you're exactly right. Employer-based healthcare clinics have been around really in the private sector for about 70 years, and they were very popular until the 1980s when the economy, and they were designed at that time as more of a benefit that private sector employers provided to their employees. But then right around the 1980s, there was a difficult economic time, and because they viewed it in that sort of context, they fell out of favor until the early 2000s when private sector and public sector organizations began to feel the crunch of additional health care costs. So they looked at that old model in a different, kind of with some different glasses on, and they thought, maybe this can help us save some cost as it relates to health care. So they resurrected theirs, and although it's very popular in the private sector, the public sector was a little slower to come to the idea of how a clinic like this could help reduce health care costs. I think in some of the research that I looked at, as of 2011, there were 10% or less in the public sector that existed. But they're becoming more and more popular now because I think there's more dialogue intergovernmentally than there ever has been before, and the council's been very good about pointing out a lot of the reduced revenue that municipalities and other governmental agencies at the local level have been receiving. So they have to come up with more creative ways to try to reduce costs. And so a partnership like this between the City of Oshkosh, the Oshkosh Area School District, and Winnebago County mitigates some of the risk involved in undertaking this endeavor because it's really spread across those three organizations. And the idea is that this clinic, in the traditional healthcare models that we have, the primary care physician and the primary care activity that takes place is not a very lucrative part of the healthcare industry. So because that is something that is structured in such a way where it is more expensive with the doctor model, the clinics themselves, from the public sector perspective, have the ability to save some money on the unit cost. And then because they'll be able to spend a little bit more time, with the patients, because they don't need to ramp up the volume to generate more income as the private sector folks do, then hopefully it will shrink the entire healthcare cost pie. I mean, those are really the two concepts behind saving money associated with the clinic itself.
Thank you.
Sure.
Mr. Mayor, if I could just chime in. I've had many conversations with Mr. Fitzpatrick about this before. In Terra, and particularly the work they've done at J.J. Keller is something that professionally I've covered closely for 4 years. The benefits you pointed out are outstanding to the city. I think some additional benefits that their clients are finding, and I know the clinic isn't going to be right on site here, but their clinics are also finding that employees, travel time to a doctor's appointment or time that they miss from work to go to a doctor's appointment is decreases substantially. In this instance, it may not be quite as much because there still will be some travel time, but it can be less. You mentioned about spending more time. Right now, when you go to your regular traditional service provider, they're charging you in 7-minute increments, or 7.5, I think it is, and that doctor's oftentimes doing everything they can to give you some advice on taking care of your health for up to 8 minutes, because when they get to that 8 minutes, then they can charge for the full 15. I don't know how this is structured within Terra, but I know in these employer-based clinic models, typically you'll pay the same amount for 15 minutes or 20 minutes that you would pay your traditional healthcare provider in a 7.5 minute. And then lastly, this kind of a model is really set up where the cost to the employee, it's more beneficial and efficient to the employee to use, and there's oftentimes greater incentive, and I think a lot of these employer-based clinics, I know it's the case at J.J. Keller, they find that employees are going to use the clinic for healthcare issues that they wouldn't on a basis that otherwise they might avoid or not take the time to go see their physician for. So the benefit there is that you're catching chronic issues earlier. You're not having those costs down the road, and you've got healthier employees. So a variety of things. We may not necessarily see a return on our investment in the first year, and I do want to say that to citizens. We may find that we triple our return on investment in the first year, but I'm confident that in our second, third, fourth years, we'll be saving more money on our healthcare costs than we're spending on this on an annual basis.
Any other comments? Questions?
Just to reiterate Mr. Gray's question, is that an appropriate figure, the $220,000 a year?
I'm sorry, I couldn't recall the question that he asked specifically about.
I think it has to do with fixed costs, and Terra has provided us an analysis of what our fixed costs would be. They're really, if you take a look at the portion, actually the previous item, with the three-party agreement with us in the school district, there's a section about payment of office lease expenses. That's the fixed cost, and over the life of this contract, a 3-year contract, it's going to be about $149,000. Let's just say $150 for the math. So it's really about $50,000 a year, and we're going to incur 20% of those costs, and that was what I was referring to earlier. So the fixed costs are those costs that we're going to have. The variable cost, and maybe the terminology that Mr. Gray is using really is referring to what we're calling variable costs. We will have physician's assistants and nurse practitioners, as well as an office assistant in there, and that they will be there at that clinic, and we'll be billed for that on a monthly basis, but it's going to be based on a percentage of usage after the first 6 months. The first 6 months, we're going to do it based on pure straight percentage, 20% for us. After the 6 months, we're going to review it, and Mr. Fitzpatrick's going to be our representative, take a look at that and agree, okay, based on the previous quarter's usage, maybe it's 19% for us, or 21%, depending on actual usage. Those are not considered necessarily fixed costs because they will vary depending on usage after that point. But for the first 6 months, in the absence of hard data, we don't know exactly how much our usage is going to be, but it could vary based on how many people we're sending right through. Now, it's called variable because as we look at this, we could find that, say, we're not getting as much demand during certain hours of the day. We may pull back hours, or we may add hours depending on what usage is. So the whole idea is to analyze this on a regular basis, because if we're not getting the usage that we're hoping for, then it's going to be important for Intera to adjust accordingly.
Correspondingly to that point that Mark was just making, we're starting out the clinic very conservatively. We're starting out with, as Mark mentioned, 2 medical assistants, 2 physician's assistants. But if the clinic becomes more and more popular, which we hope it will be, then we have the opportunity to add additional staff. So, for example, the Sheboygan Clinic, that's been in operation since 2008, they partner with the school district and also the county. They started out very conservatively until the employees had a comfort level going to the clinic, and then it became more and more popular to where now today they have added 2 chiropractors at that clinic. They also have a health coach at that clinic. So as Mark is pointing out, this is a model that we want to start out conservatively, but if it becomes more and more successful, it will modify over time. And then the idea behind that, as Councilmember Fitzgerald said, is then we can take advantage of the popularity of the clinic, and we can, the employees will see providers at a reduced cost, and that will mean that we'll save money. So that's the idea behind the model. But it will change over time, as Mark said.
But proportionally, Mr. Gray threw out a number of about, what was it, 229,000. That's probably a fair estimate of what it would be if we stayed in the 20% ballpark, because it's going to cost us something. Is that a fair estimate? I would say Mr. Gray's pretty close to being on with that estimate, and that would be the expectation, because I always thought the clinic would cost between $1 million and $1.25 million, and Mr. Gray's assessment is about right. But it'll be based on usage. If we see things going down, we'll go down, and as Mr. Fitzpatrick said, if we see the clinic really taking off, we may want to add services, because the more services we add, the more we're not getting charged by the other healthcare providers, and the fact that we bring them in-house makes, you buy more, you save more type of thing, and the more we utilize this, the greater our savings will be as we continue to use it. Same thing with the drugs, which hasn't been talked a lot about, but we're expecting a 40% discount on the drugs that we use from that clinic. Now, they're going to be very basic type of drugs. They're not going to be any exotic type. It's going to be pretty much generic formulary, real basic availability of drugs, because it's mainly it's maintenance type of services that we're getting at the clinic. Similarly, maintenance type of drugs.
Any other questions or comments? If not, I'll ask clerk take the roll call vote on resolution 14-503.
Pack.
Aye.
Herman.
Aye.
Allison Osby.
Aye.
Pansky.
Aye.
Fitzgerald.
Aye.
Cummings.
Aye.
Tower.
Aye.
Carried 7.
Okay, takes us to council discussion, direction of city manager, and future agenda items. Go EDC update. Any comments on that?
Nothing at this point. We're going through the fundraising effort. I see Mr. Peck has one of the brochures, and if you'd like to be a founding member, $50,000 will get you a founding membership. But there are also more modest participations as well. But we're making the rounds with the various businesses, getting some good reception so far, and we're going to continue to do that over the next few weeks.
Future agenda items, the sex offender workshop, which we said we'll put off till after budget season, probably after the first of the year, realistically.
Mayor, on that, I'd like to get a date on that, actually. I think as we've found out in the past, whether it's January, February, whatever month, it seems to get busy all the time. I think we actually ought to pick a council night and get it on the calendar so that those folks that are going to be invited or involved in that presentation can plan for it. I think maybe the last council meeting in January would be sufficient, which would be the 20th. Or the 27th, excuse me.
Now, are you thinking about doing it at a council meeting? Because we had talked about another meeting separately in which would have people come in, or do we need?
Are you saying the same
An off
night as a
week.
council?
Same night, it could be. I mean, I don't, I guess we have to kind of decide. We had the law enforcement side of this discussion pretty much. We have not had a community side and some of the concerns, and that's something I had brought up that I wanted to hear from the community, and I have not heard from the community as a whole of what their feelings are, but at the same time, we haven't rescheduled one. I don't know if council would like, what type of workshop are we looking for? Are we looking for specifics? I know we've gotten information on what other communities are doing. We've gotten articles about the pros and cons of having a specific ordinance. So I guess a little bit of it depends on what is council looking for. More information about sex offender registry in general, sex offenders in general? Are we looking at potentially an ordinance? What are we really looking for, I guess, would kind of determine whether we need a separate night, because it might be an hour or 2-hour workshop, or it could be, 45 minutes with, here's some suggestions from staff to where we think we should go with it, and recommendations of council. I guess it really depends on what the consensus of council is on what they're looking for.
I just heard when council members were talking about it before, they thought it might be longer than 45 minutes, and even 45 minutes is tough because we have some people that work.
Right.
And
I think that's the reason it's been pushed off as long as it has been, is because it was projected to be long enough where it was going to be on a separate evening by itself, separate from
But
council.
now, but if we don't get it on the calendar, we'll never,
I understand.
That's a good point.
I would agree with that.
Could we do it on the off Tuesday in January? I mean, does that make sense as far ahead? Try and put it on there unless we need to change it again? people's calendars probably aren't set, or their vacations may not be set, so.
My only question would be is,
Okay.
would it make sense to keep it the same week as a council week so that those off weeks for those that travel for business have that week open to travel? I'm not saying it's right or wrong. I'm just wondering, is that an option? If not, then I think the opposite Tuesday would work fine as well. My comment to the question that Councilor Herman has is, I guess, I would like to hear from the community as well, and certainly from staff. I think we had the perspective of individuals outside of staff and our community, and we've heard what they've had to say. I would like to know more at a local level and staff level.
Let's do it this way. Why don't people look at their calendars between now and the next time, and try and come up with a date. You may look at some dates the same week as a council thing, come up with, we'll throw out some dates and then pick a date, and people think about whether it's the off week or the regular week.
Well, I can tell you, January 6th is out for me. That's one of the,
January
that's the first Tuesday.
Okay, so maybe the third one, or Allison Osby was thinking of the second week on what, Monday night or something?
Monday or a Wednesday.
Monday or
But
a
we
Wednesday?
want a separate workshop from a council.
A separate workshop.
Right.
I think it's got to be a
agree.
separate workshop.
Yeah, I would agree on that, too, because whether we hear from the community or not, I think there's still a lot to be discussed. I know that the chief and his folks that he brought were kind of rushed through their presentation, so they might have more information they'd like to provide, and I think the city manager might want to weigh in a little bit on, or the city manager and the city attorney weigh in on kind of the consensus of where they feel how that affects the city in general.
Our plan was to present the council with a range of policy options in terms of how different ordinances exist out there, so you can see the whole range of options that cities have chosen to do. Some are very restrictive, some are very non-restrictive, and the experiences they've had with each of them, so you can kind of get a flavor of what, well, number one, what range you have, and then what you feel is appropriate for our community. That's really the intent about what we were going to do at the workshop. So I do like the idea of not having it on a council night, because depending on the range of options, you may want to talk a great deal about it. It's been a while since you've talked about it, and you may want to strategize on how do you get community input on an issue like that. I don't think you're done with the next workshop. I think you're setting the table for being done, but you're not going to be done. The mayor suggested to just put it on the next agenda. I'll have Pam put it on the calendar.
Okay,
Please bring your calendars, but we should start looking at January about what your schedules are.
Maybe
That's probably most
look at the second and third weeks if you have vacation plans. I don't know when people go away, but if we know somebody knows it, we can eliminate some dates, and then we can try and pick a date. I get a lot of openness, but some of you don't, so depends on what people have. So 25th, let's,
Perfect.
25th could be a busy night.
Yes.
Okay, the strategic plan presentation.
My thinking with this one was that perhaps even before the end of the year, we could put a little time in a council agenda. I don't anticipate the agendas between now and the end of the year to be very heavy, and perhaps we could devote a little bit of time, not unlike what we're doing this evening with the budget workshop, but we've been presenting the budget with the idea of what the council had done with the strategic plan workshop retreat that you had, but you've got to get a final look at it and say, how are we going to do this? The details with staff are really going to be largely dependent on the budget, because there's a lot of detail in there, and how much we can do is really going to be limited by our resources. But the general information, I think we're ready to show you, and actually ready to discuss it. But getting more details, I'm thinking, we could even do this on December 9th, which is our meeting after the budget's adopted, so you can get an idea of how we can put the strategic plan into place within our budget limitations for the following year. And I'm talking a half-hour discussion. And I think we could do it within the context of a meeting. I don't think we need a workshop for it.
Other
Can we
thoughts?
commit to that, the 9th?
Yeah, unless I see something, which I don't anticipate right now, I don't anticipate a big agenda for December 9th, so we may as well just put it into the context of the council's meeting.
Because in some ways, the sooner the better, because we really did this back in
August.
July. It was July or August, I can't remember. was that far back? I can't
It was
remember
sunny
what month
and
it was. It was warmer than
wasn't
today.
snowing.
July.
But also, we have some materials. I came in downstairs, and that's the old strategic plan that's up on the board that people walk into, and we're 6 months into the new one, so we need to move on that. So the 9th, it looks like we'll do it the 9th, and then we'll move forward with publicizing it, too. I think that's going to be important. Okay, citizen statements to council. If anybody would like to come forward, make any comments you might make, positive or negative, regarding the city. Guess there's no need for me to go through all the rules. No one's coming forward. Okay, the next thing is city manager announcements and statements.
Thank you, Mr. Mayor. I have a memo in your packet regarding advanced work we're doing on the 2015 capital improvement program. And the idea behind this is to get ourselves in a position where we can hit the ground running with with next year's CIPs. Getting it done now means we can get it before the ground freezes, which it's in the process of freezing as we speak. The quicker we can get the contractors out, the better we can get our bid documents ready for earlier bidding out for next construction season. That's all I have.
Okay, remainder of the meeting just gets a little bit awkward, and we have to do this in accordance with state law and all those kinds of things. We're actually going to go to have a budget workshop. We're going to move to the back of the room. Technically, the meeting is still going on, so that budget workshop is within the context of the meeting. As we come to an end of the budget workshop, then we'll have the motion to go into closed session, then we go into closed session, because we really can't go into closed session, talk about going into closed session, have an open meeting, and then go into closed session. So what we're going to do now is we're going to take a little break. Can we go directly back there, or does anybody need to take more time on that? Let's go back. We'll be in the back of the room. We'll have the budget workshop back there, and hopefully Andy can make that all work so we can be on TV from the back of the room.